Hello, Dr. Stephanie Gray with Your Longevity Blueprint and the Integrative Health and Hormone Clinic. Today I want to continue with part 2 of this series on hypothyroidism. So in part 1, we discussed symptoms of low thyroid, including cold intolerance, fatigue, sluggish metabolism or inability to lose weight, sluggish bowels like constipation, poor memory, dry skin, and even swollen tongue. I also mentioned the importance of obtaining a full thyroid hormone panel, including TSH, free T3, free T4, reverse T3, and even thyroid antibodies. So if you have symptoms and your labs are also showing that they're not optimal, what can you do about it? Well, definitely find a functional medicine provider who can treat you, but today I want to discuss what nutrients are really important for thyroid function that you can take on your own. So remember how I said in the past video that many of my patients don't convert their T4 to T3 well? Well, this can be due to toxins like alcohol, pesticides, mercury, lead, various medications like birth control pills, steroids, beta blockers, and even eating too much of certain food groups like soy. And lastly, what we'll talk about today, nutritional deficiencies like selenium or zinc. This can also be due to elevated thyroid antibodies and even adrenal stress. So what can you do to improve thyroid hormone production and improve the T4 to T3 conversion? Reduce stress, support detoxification, when possible get off medications, and then lastly, take the nutrients needed to make and convert thyroid hormones. So I'm going to focus on that last bullet point in this video. So T4 and T3 are made out of a tyrosine backbone and then either 3 or 4 iodine molecules, kind of fitting together like this. Iodine is an essential trace mineral and necessary for the synthesis of thyroid hormones and is one of the most important components of T4 and T3. So you need both tyrosine and iodine to make thyroid hormones. Now the minerals zinc and selenium are required cofactors or helpers for the enzymes that convert T4 to T3. Selenium deficiency has been shown to contribute to decreased T4-T3 conversion, and supplementation of selenium has also shown in the literature to help reduce thyroid antibodies in thyroid autoimmunity cases. Supplementation with zinc has been shown to restore T3 levels in patients who have normal T4 but low T3, demonstrating its role in that conversion process as well. And then other nutrients like vitamin A and vitamin E are also necessary for normal thyroid hormone manufacturing. Now additionally, increased free radical activity or oxidative stress can compromise healthy T4 to T3 conversion. So taking antioxidants like N-acetylcysteine, which is a precursor to the body's master antioxidant glutathione that I've talked about before, can boost thyroid health by accelerating antioxidant activity in the thyroid gland. And many thyroid support products don't contain antioxidants. Now turmeric, along with vitamin C and vitamin E, has been shown also to support a healthy thyroid gland due to antioxidant activity. And we know turmeric is anti-inflammatory. And if you have an autoimmune condition, we know your thyroid's inflamed. So taking anti-inflammatories like fish oil and turmeric are very important. And then lastly, herbs like ashwagandha have been used in Ayurvedic and indigenous medical systems for thousands of years. Now, ashwagandha specifically has been examined in research studies for its stress-lowering effects. It can relax the nervous system and stimulate thyroid activity. So remember, if stress is your body's biggest hormone hijacker and can lower T3 and increase reverse T3, taking that ashwagandha can help calm the system to help promote more of the important T3, reducing that reverse T3. And then gulgul lipid has been shown also to support thyroid function, primarily by decreasing lipid peroxidation in the liver, which is the principal site of T3 generation. So the best blend that I've seen to support thyroid hormone production is our Thyroid Complex. So this is a comprehensive formulation that provides the blend of nutrients and botanicals that I mentioned in this video working in synergy to support thyroid health. So it has tyrosine and iodine, which again make up the backbone of those thyroid hormone levels. It contains zinc and selenium, which I mentioned help with conversion of T4 to T3 and lowering thyroid antibodies. It has anti-inflammatories like turmeric and antioxidants, vitamin C, E, and N-acetylcysteine. It also has the ashwagandha and the gulgul lipid that I mentioned. So our Thyroid Complex is a great blend that can help to maintain thyroid function, promote the synthesis of more thyroid hormones, help convert T4 to T3, and improve cellular sensitivity to thyroid hormones. So lastly, if you've had elevated thyroid antibodies, what else can you do? Changing your diet to eating gluten-free is extremely important, and I'll explain why here. So when the thyroid is inflamed and leaks out thyroid peroxidase enzymes, these look like gluten, And if your body is already on attack or alert for gluten, it may also attack these enzymes. So that creates thyroid peroxidase antibodies, which lead to autoimmune thyroid disease like Hashimoto's if low thyroid is present, or Graves' disease if high thyroid or hyperthyroid or overactive thyroid is present. However, this process doesn't only create autoimmune conditions in the thyroid, it can create autoimmune conditions such as multiple sclerosis and rheumatoid arthritis, and even others elsewhere in the body. So if you have an elevation of these enzymes, you want to stop fueling that potential autoimmune fire, and avoiding gluten has been shown to be one of the most important diet changes these patients can make. So gluten is the protein found in wheat, barley, rye, and oats, unless the oats are gluten-free. So you should avoid gluten, but you may need to also avoid other foods as well. And this is where food sensitivity testing comes in. This can be very valuable to help you determine which foods you should avoid, which should then help thyroid function and reduce the thyroid antibodies. So many of my patients with elevated thyroid antibodies have reduced significantly by changing their diet and taking the nutrients above. So if you want to learn more about Hashimoto's thyroiditis, the autoimmune thyroid condition, hypothyroidism in general, and what you can do to prevent the progression of other autoimmune diseases and improve your body's internal production of hormones, read more in Chapter 6 of my book, Your Longevity Blueprint. Thank you for tuning in. I know this was a longer video. Hopefully you learned something. So please share this knowledge with friends and family. I'd love feedback, so feel free to leave a comment here. Please like and subscribe to my YouTube channel, and remember that wellness is waiting.